While the impact of COVID-19 on the economy and healthcare systems is still evidently with us, the National Agency for the Control of AIDS, NACA, continues to persevere, with more persons placed on treatment as well as significant decline in morbidity and mortality rates. As we move into the year 2022, we look at some of the efforts of NACA in the face of numerous challenges presented by the new normal in the previous year.
We've done tremendously well. We've done well 2020. 2021, we sustained that momentum in expanding treatment and also getting people on treatment, getting people to identifying cases and linking them up to treatment, which is very, very important for controlling HIV. We cannot control HIV without identifying people among us that have the virus, and identifying them is not enough. We also have to link them to where they access life-saving medication. So that one is also not enough. We have to work with them to make sure they continue to take this medication, because that is what keeps the virus in them and deny the virus the opportunity to leave them to affect other people. So we have done tremendously well as we did in the year 2020.
The 22nd of February 2021 marked the 14th anniversary of NACA, and what better way to start the year than to reflect with stakeholders and partners on the HIV and AIDS journey thus far, take stocks, review the status of the response, and share the vision to end the epidemic by 2030.
If not for the policy, National HIV/AIDS policy, National HIV/AIDS strategy framework first, and then the plan, people will probably be drawing money from different sources all over the world, doing whatever they like in the corner of their rooms. But with that vision, from NACA leadership, it set the tone for what should be done, how it should be done, by who, at what level, and what results, more importantly, what result do we expect to see. So I think we need to applaud NACA for that. And also, very importantly, you can't do anything without capacity. I think one of the key benefits we've gained from NACA as a country with regards to response, even beyond HIV response, health system strengthening, is capacity that NACA has institutionalized all over the country. So on that note, I want to appreciate NACA once again and commit that from CCM perspective, we will constantly and regularly partner with NACA beyond what we are doing at the moment, to also include other areas that will come up as we move forward.
We are truly excited. This is just 14 years, and we look forward to the years ahead, even as we continue to count on the very strong leadership of NACA to frame the policy direction that will finally take us to end this epidemic. But more importantly, to sustain the gains we've made. And I can see some really exciting discussions already in place. So congratulations for the journey so far, for the great success recorded, and to say we are truly proud to be associated with NACA.
In the last 14 years, I make bold to say that this agency has achieved so much in its mission, to the admiration of government and partners. Millions of people now have access to ARVs, and global targets for prevention, testing, and treatment are being met.
To tackle the increase of new HIV infections among adolescents and young people in the country, NACA, in collaboration with the Federal Ministry of Health, UNFPA, and UNICEF, launched an HIV prevention dossier integrated into 3 titles, namely, the HIV Investment Case for Adolescents and Young People 2021 to 2025, the National Condom Operational Plan 2021 to 2025, and the National Condom and Lubricants Quantification Plan 2021 to 2025.
It will be impossible to control HIV without stopping HIV transmission. Treatment at best can give us 60% of that. The remaining 40% must come from an efficient and effective prevention program. I'm particularly happy when I see focus on AYP, because if you look at the taps that are running in terms of transmission, we have our hands virtually on all of them, with the exception of this. I don't see them on my data list, and I don't see them program-wise, and I'm concerned. So the focus on this group is really very encouraging, and I hope we'll continue to work together on this population group until we're able to turn things around, until we're able to see what is happening.
In line with its core mandate of coordinating the multi-sectoral campaign against HIV and AIDS, Naca intensified stakeholders' engagements, seeking new collaborations and to strengthen existing ones, such as national faith-based organizations coordination meetings, workshops for media as a critical partner in fighting HIV and AIDS to finish in the country.
HIV, by its nature, it's a human matter. And so when you are going to talk to the person, to the human person, you need to speak to the person's heart and to the person's brains, all right? So you need stories that are emotional in nature, and that's what's missing. A lot of Nigerians know about one or two things about HIV by now, but what's missing is that compelling feature story that will move that person from the point of awareness to the point of knowledge, where he or she is able to, on her own or his own, be able to take a useful decision to improve his or her well-being using factual reporting by the media.
For us journalists, we normally, think we know it all until you come to places like this and begin to understand that there are certain things you don't know. And for the work that we do, to be able to effectively inform people, we need to be informed. So for me, my key takeaway is this. Sincerely, before now, I didn't know that there was something like PrEP. But now that I know about PrEP, I'm going to be doing a lot of research about it. I'm going to be helping them disseminate that information. For me, it's my key takeaway.
This program has been very, very impactful because in the past, I've been seeing, HIV and AIDS from another different angle. The way we write stories, we just write them, we just feel I have a story to write about somebody. But today with this, I've come to understand that I have to write the stories with empathy. I have to put them into consideration that they are human beings. They could be somebody's sister, they could be somebody's brother. So it has really changed my perspective towards writing stories about HIV and AIDS.
And workshops on pediatric HIV and tuberculosis.
This meeting is very timely because it demonstrates the sense of urgency by the government of Nigeria to initiate a call to action and to mobilize the whole of government, key multi-stakeholders, private sector, academia, etc., including faith-based organizations, to eliminate pediatric TB and to end the AIDS epidemic among children. I pledge UNICEF and the whole of the UN joint team support for Nigeria to end the HIV and TB epidemic among children.
There is every reason why we need to prioritize children. Children, as we speak, with the HIV treatment program, coverage is just about 45% as compared to adults, which is over 90%. So children are being left behind. So this meeting is to see how we can ensure that children are brought to the front, coverages are increased, we reduce new infections by addressing issues about mother-to-child transmission of HIV, through which children get infected, and then also making sure that in terms of deaths, we mitigate deaths among children by first identifying those children who are infected out there, improve on diagnostics in terms of how we can identify children with HIV and also TB. So those are the things that is calling for this 3 days meeting.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols, wear a face mask, and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria.
Hello?
Hello, babe. What's up? How is Valentine be now? You know I love you.
Love no be for mouth. Now by action.
You have to show it. First to yourself and then to others.
So show love this Valentine's season by getting tested.
Know your HIV status. It is free in every government hospital. I beg, make gonna try whole body. But if you know fit, practice safe sex. Protect yourself and others.
And finally, love is the best treatment to heal the pain and stigma of people living with HIV.
Helping us achieve a country free of HIV is the greatest show of love to our fellow Nigerians. Spread love, not HIV. Happy Valentine's Day.
The agency carried out several capacity building and empowerment programs to address poverty, gender inequality, and human rights violations, which are major drivers of the HIV epidemic.
HIV is a disease that has to do with poverty, a disease that is also to some extent fueled by insecurity. It has an economic angle to it, it has the health perspective to it. So it's a disease, if you want to fight, you don't just fight it from the hospital perspective alone. You have to go into community, you have to identify vulnerable individuals, people that are at risk, and find ways, to reduce that risk. So in finding ways to reduce the risk, we have had programs that concentrate on vulnerable population among people that have the virus, and also among people that don't have the virus, to support them and empower them and also educate them. It's much faster if we show some kind of human face to it, where we're not only concentrating on telling them what to do, we are also concentrating in helping to empower them to be able to do what we want them to do. So that's the goal, and we are happy. We've empowered about 12,000 individuals across the country. It's a small undertaking, but this is what our resources can support.
One other mandate of Naca is to support HIV and AIDS research in the country, and the agency has facilitated several studies and research, such as the Needle and Syringe Pilot Project to examine the feasibility, effectiveness, and quality of a needle and syringe program in Nigeria among people who inject drugs.
We see this population group as critical, and we see this an important tap that has been running over the last several years that has to stop for us to control HIV spread in the country.
We're able to engage up to 2,700 people who inject drug and build a very rich body of knowledge and evidence around what needs to be done as a response to actually roll back transmission of HIV within this group. So for us as an organization, it's been a truly satisfying experience. We remain very available to support in every way we can the national response, even as we move to scale up.
University of Manitoba Institute for Global Public Health being a key partner to the government of Nigeria in areas of research, technical assistance, capacity development, and very importantly, contributing to global knowledge, generating it, analyzing it, sharing it globally, and contributing to global efforts in turning off the tap for the epidemic. To work with you beyond this, in other areas of research, in other areas of technical assistance, to ensure that we continue to contribute the richness of Nigeria programs to the globe.
And mode of transmission study that shows where new infections occur and among which population group in the country.
In this study, we see a new group, and this new group are the never married adults, the female and male. Never married adult, female and male are now joining the league of running taps that we need to redirect our resources to make sure our effort both at prevention and treatment, as well as creating awareness, in this group pays by helping us to turn up these taps and turn them fast.
Never married, uncircumcised and circumcised men around age 18 with an age range between 19 and 31 are responsible for have new infections. Never married with median age 22. And for this, a deep dive still needs to be done to be able to exactly locate what are the traits and other demographics of those particular group. And then we see female sex workers, men who have sex with men, and then the newborns. Across the states, the infections are occurring among never married individuals or seronegative couples, people who don't have the infections before. And then the third source is the mother-to-child transmission of HIV.
Research is one area we also do as Naca. So we've looked at the work we did in 2020 and the one we added in 2021. We've identified population groups now that are at high risk of getting a new infection, and this will be the focus of our program going forward, making sure that we're accessing these population groups and we're identifying the new infection among them and treating them, because the individuals at risk of giving HIV to others are individuals who acquire the virus recently, when their body defense mechanism is yet to recognize that the virus exists. So that is the stage at which the virus multiplies without mitigation. And that is the stage at which virtually any encounter, or every encounter, puts the other party at risk of acquiring HIV, especially one that is not protected.
To reduce dependence on foreign donors and push for more country ownership and sustainability of HIV response, Naca carried out several advocacy visits to state governments.
The purpose of that visit is to have a kind of opportunity to have one-on-one with the state chief executive and to inform them about the work Naca has been doing for the last several years in the state, and our intention to now collaboratively work with U.S. government in those states to train the state's stakeholders, especially individuals and groups from the government side that implement HIV program, to train them, work with them, and see them doing it while we step aside. And this is the beginning of what we're calling sustainability model. We are building a model from Abia and Taraba that later we intend to scale up nationwide. So the purpose is to alert or to let the chief executive know what we're about to start doing and solicit for their cooperation, understanding, and support. And we're happy this visit was successful.
As Naca drives the process towards the concluding chapter of the HIV and AIDS epidemic in Nigeria, what should we look forward to in 2022?
Looking forward in 2022, you will see increased activity on prevention of mother-to-child transmission, because this is one area that we haven't done as much as we want or we hope to do, simply because it's a very difficult program, in the sense that you can't force people to come forward for antenatal services. But one thing we can do, and we are doing, is we can take the services to the community and creating awareness among individuals that every unborn child has right to be protected from HIV. And that right can only be guaranteed by the parents, the mom and the dad. And the first step in granting that right is to know about their HIV status.
The National Agency for the Control of AIDS, NACA, holds the mission to end AIDS epidemic by 2030 as a historic obligation to the country, a task it is gradually achieving through global solidarity, evidence-based interventions, and multi-sectoral partnerships.
They go like this now. Take am easy now.
Now hospital I dey go to do HIV test.
Now everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o. During pregnancy or labour, or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sen ten ce. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
What we want people to know is that there is an act against HIV stigma and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a number one enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng.